Hello friends, today we'll be talking a very important topic in community medicine, that is epidemiology, and we'll be dealing a long question today, which is define epidemiology, classify epidemiological studies, then tell about the aims and uses of epidemiology and discuss the tools of measurement. So to begin with the definition we start. Epidemiology is defined as the study of occurrence and distribution of health-related events, states and processes in a specified population, including the study of determinants influencing such process, and then the application of this knowledge to control the relevant health problems. Now come on to the classification of epidemiological studies. So basically we have two types of epidemiological studies. One is observational and the other is experimental. If you see in observational studies, we have two types of studies, descriptive and analytical. Now descriptive studies are further classified into two categories. First is case study, the other is case series. In case study we have deal with a single participant, and in case series we have multiple participants. And what we discuss among them? We discuss about them in terms of time, place and person. Coming to analytical studies, we have cross-sectional studies where we calculate the prevalence of a particular problem, and therefore these studies are also known as prevalence studies or snapshot studies. Then you have case control study where we can find out the odds ratio. Then we have cohort studies. So cohort studies we can find out the attributable risk, relative risk and population attributable risk, which we'll be talking in great detail in upcoming videos. Then comes the last one, that is the ecological studies, where we find out the correlation. Then coming on to experimental studies, here we have popularly called as RCTs. Then we have before and after studies. Then we have crossover designs. Then field trials and community trials. In basically descriptive studies, what we do is that we formulate a hypothesis. Now what is hypothesis? We'll be discussing in upcoming videos. For now on, you should only know that it is descriptive studies are used to formulate hypothesis, whereas analytical studies are used to test a hypothesis. Now come on to the aims of epidemiology. As per the definition, when we go, first it was a study of occurrence and distribution of health-related events, states and processes. So similarly, the first aim is to describe the distribution and magnitude of health and disease problems in human population. So to describe the distribution of health and magnitude of health and disease problems. The second is to identify the determinants influencing such process. So similarly, you have the second aim, that is to identify the etiological factors in pathogenesis of a disease. And third was to implement this knowledge to control relevant health problems. Similarly, you have third aim, that is to implement the data essential for planning, implementation and evaluation of services for prevention and control and treatment of the disease, and to the setting up of the priorities among those services. So these are the aims. Now it was easy to grab it from the definition itself. Definition should be written word to word as given in the book, but rest of these things can be written in your own words if you understand those concepts. Now come on to the uses of epidemiology. The first use is to study the historical rise and fall of a disease. Like if you have seen plague, it was a very rampant problem in earlier times. Now it has declined. Similarly, you can see the non-communicable disease, which did not happen so much in the past, now are extremely blooming. So you can see, study the historically the rise and fall of a disease. Second is you can study about the community diagnosis, which we'll be discussing in great detail in upcoming videos. Then planning and evaluation of individual risk and chances, then syndrome identification, studying the complete natural history of a disease, and also for searching causes and risk factors for a particular disease. Now The last thing that comes here is the tools of measurement. So first of all, we have rate. Rate means the occurrence of a particular event in a defined population during a given period of time. Basically, rate is for a particular time period. So the time here is defined. For example, you have death rate. Now death rate is number of deaths in a particular time period upon the mid-year population of that year. Mid-year population of that particular year. Now this into 1000 makes it to the rate. Similarly, you have crude rates like crude death rate, crude birth rates, then age specific birth rate, sex specific birth rates. Similarly, you have standardized rates. Then comes a ratio. Ratio expresses the relation in size between two random quantities. Now here the denominator is not a part of the numerator. So you can here have like a sex ratio, number of boys to number of girls, or doctor patient ratio. Then comes proportion, where the numerator is a part of denominator. Like what can you have in proportion is like number of children with scabies in a population upon total number of children. Total number of children in that population into 100. Whenever it's a proportion, the multiple is always 100. Whereas if you see in rate, the multiple can be 1000, 10,000 or lakh also. Two very important short notes you get is maternal mortality ratio and maternal mortality rate. So now this you should tell me what it is, and we'll be discussing this in further upcoming videos. Thank you so much for patiently listening to this question. I hope it was helpful for you. Thank you.